We are now moving to a very special leadership conversation. AI is increasingly becoming a strategic driver of operational excellence and organizational transformation. To discuss this further, please welcome Mr. Prashant Koduganti, Vice President Operational Excellence at Optum Operations Global, and Mr. Sanjeev Malhotra, CEO, MIT NASCOM Center of Excellence. To lead this conversation, please welcome Ms. Ekta Batra, Senior Editor, Pharma and Health at CNBC TV 18. Please give them a warm round of applause.
Just start and hi. Well, Prashant as well as Sanjeev, thanks very much for joining in and speaking to us with regards to this panel. Good morning, everyone, and welcome to this panel. Just to put it into perspective before we start talking about, start quizzing our guests in terms of the questions, want to put this conversation into context. Healthcare today is being fundamentally reshaped by AI, digital health, and connected care. As patients' expectations rise and healthcare systems face growing pressure, innovation is no longer optional but is mandatory, and it's becoming central to how care is delivered, scaled, and accessed. So, in that context, we're going to spend the next 20 odd minutes discussing where exactly AI is leading us in terms of healthcare in India and how critical it is for us in terms of growing the healthcare infrastructure in the country as well. Prashant as well as Sanjeev, thank you very much for joining in. Well, just an opening question to both of y'all. Prashant, let's start with you. Healthcare is at a clear inflection point today. From where you sit, can you just give us a sense in terms of what is possibly the most significant shift that you've seen when it comes to innovation and healthcare in India? Prashant.
Thank you. Firstly, thanks a lot for having me here. It's a pleasure and honor to be on the esteemed guest. Firstly, I think from an AI and an innovation perspective, especially healthcare is at it's the best use case for innovation in AI. To think about how we are looking at innovation is how do we move away from being reactive, being episodic to getting more predictive and managing health. Girish and spoke about that earlier. Girish and Dilip spoke about that earlier. How do we kind of move away from, treating illness to managing health? I think that's where the focus of innovation has been over the past couple of years. And that's the direction that we would want to go to.
Okay, so treating illness versus managing health. Sanjeev, what exactly would your view be with regards to where exactly the significant shift or the most significant shift is taking place when it comes to innovation and healthcare?
So, where I sit, I get to see both sides. We work with large startup ecosystem, all the new startups in the country, where most of the innovation originates, apart from the large companies, of course, and some of the healthcare providers and the companies we work with. What I have seen is adoption is mainly been on the diagnostic side a lot. Earlier, the things which were experimental are now coming in the mainstream. It was said earlier also in the session, like whether it is on the imaging side of things, right? What radiologists used to do, AI is now becoming their assistant now. Things which used to take 10 minutes are now taking 2 minutes. So big change there. Already adoption is happening. Then same thing in different parts also, whether eye care, some of the, again, diagnostics is becoming easier. Detecting glaucoma or cataract or such kind of disorders is becoming far faster and accurate now. And you don't need a physician always to detect these things. So these are the things which I have seen already happening, and adoption is, it's gone from labs to actually field, it is already there.
Okay. What is the accuracy when it comes to this kind of adoption? Say, for example, you did mention diagnostics. You mentioned opthal, where it is being used in terms of, diagnosing cataract, etc. But what is the accuracy of AI and the margin of error?
It's pretty high. I think all these numbers are in the range of 90s, I would say, 90 and above. Then only gets into the mass adoption. There may be some errors here and there, but regulation doesn't allow only AI. It has to be further validated by a physician. And humans can make error also. It's not that humans were doing 100% perfect job. So I think we must remember that. But when you combine both of them together, chances are patient wins.
So where I was coming to, where I'm planning to, possibly go with this question is that eventually which one is dispensable in terms of usage? Is it going to be that the human becomes dispensable and AI takes over all diagnostic tools? And if so, when do you see that happening by?
That, see, technology may allow you to do that, but regulation will not. Regulation will always want human accountability there. So I think human in the loop is essential there. The jobs become much better, faster, less strenuous, but I wouldn't think anything is indispensable at this point of time. So we are, as I said, getting to better accuracies with both of them there. So I don't foresee anything going away in the near future.
The other thing that you mentioned was also the word accountability, and this is something previous speakers spoke about as well, that the company itself should also have some accountability in terms of the diagnosis or the usage of AI. Do you think that if in case there is mass use of AI in healthcare, will accountability be equal in terms of the amount of usage that we're seeing?
In accountability on technology and
Yes, for example, say if the software makes an error, and who at the end of the day is accountable for that?
See, in the end, that's the reason regulation exists, because at the end, physician has to sign it off. So ultimate accountability will be on the physician. And I think we don't have a solution, or I don't think it's being discussed even to remove that part at this point. So I think accuracies will get better. Technology always gets better with time. That's always be the case. I mean, whatever you see early 90s may become almost 100% at the end of it, right? Even then, you need to have physician in the loop, just in case.
Prashant, you mentioned speaking about reactive and preventive healthcare. As of now, where do you think we are when it comes to AI? We're more reactive. Do you think that we're going to start slowly shifting more towards predictive? And if so, what might be the journey to get there?
I think absolutely the answer is yes, that we need to get to more predictive. And like Sanjeev mentioned, AI is getting there, but it still needs to progress further. And to the earlier question that you had in terms of accountability, humans are responsible for making AI better. How do we make sure that you close loop from the data to insights to actions, and then how are the actions coming out to measurable outcomes, and how are these outcomes are accurate or not, is what the humans will need to kind of come in and kind of train that AI model. So as we think about these AI models getting better and better, the predictability will also happen. There is huge amount of data that is available. How do you make sure that that data is taken in for decision making, and also be able to get left shift that entire thing to say what are the indicators of predicting, let's say, a cancer or glaucoma or diabetes? Those are the things that we will need to get to very soon.
Well, just wanted to take that point forward with regards to measurable and scale. Prashant, at this point in time, the real question is how exactly does innovation translate into meaningful outcomes? While we do have AI, we have the tools available to us. From your perspective, what are the key elements that turn this innovation into real measurable impact in terms of healthcare at scale?
That's a good question. I'll steal a point from Dr. Uma. When in her closing remarks, she said, patient first. I think it's very important for us to look at innovation from a patient perspective. we are all providers for the patient. Whether you are from a technology, you're a doctor or an engineer, the patient needs to come first. From a patient perspective, it is access to healthcare, it is affordable healthcare, and accuracy and quality. The three A's that you would think of: access, affordability, and accuracy for them. If you're driving innovation and if you're not measuring your innovation against these three elements, it is very difficult to kind of put an ROI or a cost benefit analysis. Ultimately, all the innovation needs to lead to real world impact. And you will need to make sure that before you do any innovation, think about what is that measurable impact, to your point, and how is it that it is positively impacting it. So that is very critical. Otherwise, it's just going to be what you call it as innovation theater. It is just going to be on paper and not necessarily have any real world impact.
That's a good follow up to have that. What exactly is separating innovation theater, like you mentioned, that it looks great on paper, from innovation that genuinely improves patient outcomes? Innovation theater versus actual innovation, which translates into meaningful outcomes.
Again, if you think about, and there are people in this room, I'm sure there are a lot of pilots and proof of concepts that we've all been engaged in, but they just remain as POCs or pilots and don't really get into scalable innovation or scalable solutions. One of the things that we need to make sure is that whatever solution that we are creating gets embedded into the workflow, whether it is clinical, whether it is administrative. How do you make sure that when you're innovating, you're trying to look at what is the problem that you're solving for and involve the people who are, experiencing that problem day in and day out, and work with them to identify the solutions versus trying to experiment in a lab and then saying, hey, this is a solution, let's go ahead and implement. That's the biggest challenge that we have where, and what we call it like Gemba. Gemba is go see in lean terminology, is to actually go to the place where the production is happening or transactions are getting processed, understand what the challenges are, and then work along with those operators to be able to understand what needs to be fixed, how it needs to get fixed. If you look at, there is a famous equation is Q into A is equal to E. Quality of solution and the adoption of that solution, acceptability of that solution is the effectiveness of the solution. 80% of the solutions or 80% of innovation doesn't work because the acceptability of the solution is not there. So it's very important when you're doing innovation to be able to go and understand and work with the people who do this day in and day out and who are responsible for implementing those solutions. And that's where the buy-in and the challenge comes. So I think in my mind, if you're looking at making something innovation real, one, it has to be on the ground. Second, it has to be scalable. While you do it in a very contained environment, but you also need to think about how you can scale this further.
Understood. You also, amongst your three A's, mentioned affordability along with accuracy. Accuracy we've discussed to a certain extent, but affordability, especially in a country such as India, where majority of your healthcare costs are in fact out of pocket at this point in time. How exactly is AI going to reduce that burden according to you?
Not just India, but across the globe, healthcare costs are increasing. There are a lot of challenges in terms of, like we heard earlier, in terms of doctor fatigue, provider fatigue, patient fatigue, and all of that. All of these kind of increase the cost that one person has to kind of bear, especially in India, because its majority is out of pocket. Insurance is still not scaled up. AI can help in reducing the administrative burden. While there are early diagnoses that can be done, you can also make sure that you have lesser administrative costs, provide access to a lot more underserved people as well. How do you make sure that you are streamlining the process? How you're leveraging technology to be able to do more with the same staff? Those are the things that will help reduce the overall costs as well. So those are the kind of things that are being done across various healthcare systems to try and see if there is, you could do 3 people's job with 1 person because you're complementing the work, administrative work, through AI. So that's how we're looking at it.
Okay. Well, Sanjeev, which of these technologies that we're discussing today and which you have possibly seen as well. You spoke briefly about diagnostics as well as opthal, etc. But which exactly is moving the needle formidably in India at this point, and which one do you think is going to make a genuine difference 4 to 5 years down the line?
All of them. I am very gung ho about it. I think a country like India, see, world problems are pretty similar everywhere, right? I mean, cost of care, access of care, aging population, uh, ease of access, right? All these things are pretty similar. And India demographics, of course, cost becomes far more important than rest of the world. And so I feel these AI, new technologies, AI coupled with few more, uh, actually is going to make access and taking especially innovation related with what India needs, right? Low resource settings. So that's going to make a big difference. Eye care, for example, right? I mean, so many people lose livelihoods because of glaucoma. How do you? I mean, we don't have a solution. We can't produce 10 times the doctors, right? But we can definitely produce 10 times the machines, which are low cost. So I see that making a huge impact, diagnostic and easy, and some of this efficiencies in the hospitals, for example, as he talked about administrative and operational overload, right? Whether it is in billing or it is in setting an appointment, all these things are being AIs come in most of these areas, and we'll see higher adoption, and which will bring more efficiencies. Doctors' time, they will get clinicians assistant sort of a thing, not a replacement assistant for them. That will increase their efficiency. So I see everything making a positive impact in next few years.
Do you think that it could change the way healthcare is approached in India? Because today we talk about a majority of the hospitals being in tier 1 and now even tier 2 cities, but there's hardly any penetration into the rural areas. Like you mentioned, a machine is replicable as compared to a doctor. Do you think that would possibly be a game changer in order to increase the amount of healthcare access that we have in the country?
100%. See, problem in India is not lack of knowledge. Question is, I mean, people who need to have that knowledge don't have it. So knowledge exists. So I think some of these technologies will enable, we need to, sorry, the other way is to look at it, to enable our workers to get trained on these technologies. I think Dilip mentioned about it, how he talked about ASHA workers are doing work in the field using some of these devices. And we believe that these technologies, once they get into the hands of field workers, impact is going to be much more.
Okay. Prashant, while we are talking about AI innovation and healthcare, in fact, expediting because of it, there is also the policy standpoint. What do you think needs to possibly change from a policy standpoint in order to support AI and its journey in India?
I think there's already being a lot done on the policy side. We heard Vikram talking about the Ayushman Bharat digital mission, the policies around data privacy and all of that. There's a lot that is happening already across, from a policy perspective, but policy also needs to be supported by the right infrastructure and the right collaboration across, whether it is be the government, be the academia, be it the startups, be it the enterprises, to be able to kind of come together to kind of look at that holistic individual called patient, right? So I think that's where we all need to come together to kind of have that North Star of saying that what are the patient outcomes? It's the access, it's the affordability, and it is the quality of care that we will need to provide. That's essentially, I think, how we'll need to kind of look at this.
Anything specific for startups?
Well, I think the advantage the startups have is the speed with which they can look at some of the edge cases or the use cases that probably enterprises sometimes or the academia do not really kind of prioritize. That's the advantage that the startups will have, being nimble, being agile. One of the things that they will have to be very careful about is not just do pilots, but how do they kind of scale it up, make sure that they're looking at from a, the the policies around the AI frameworks being equitable, having that trust, and the governance models need to be right. Those are the couple of things that they will need to focus on. The time is ripe. Healthcare, there is a lot of happening around the digital highway through the Ayushman Bharat. There's data availability. There's a lot of advances on AI as well that's happening that can help, not just look at creating point solutions, but solving the entire healthcare problems.
Well, on that point, Sanjeev, just wanted to understand how exactly can public institutions, enterprises, innovators, emerging innovators as well, really collaborate in order to effectively solve for scale along with innovation?
That's that's a tough problem to solve. It's the right thing to do, but not easy to do. That's what institutions like ours are attempting to do, uh, because innovation cannot be done in isolation, and everybody needs each other, and everybody benefits from that. Also, uh, it's not for one. So I think uh, government is enabling few things from their side on the data side, as we heard Mr. Vikram. We also see hospitals getting more engaged with it. They see the benefit of this technology. Enterprises are anyway working towards it, and startups need to be enabled a little bit more from our side. And I believe this is a thing we all need to endeavor to do.
Do you think that innovation is going to be startup led or large company led?
It will be, I think both have a role to play, but it will have the leading part will be done by the startups. And enterprises have a role to play. They bring a lot of heft and the muscle behind it, I think, and obviously they are able to scale it much faster.
Okay, all right. Well, we're running out of time. So, just a few closing comments. Everything we've discussed today, the ecosystem collaboration, AI at scale, policy enabling innovation, is exactly what HealthX Elevate, which is an initiative by Network 18 and Optum, which has been created to champion. So, and we are proud to announce that we will be shortly accepting entries for the second edition, which is with NASCOM, which will be joining us as an industry partner for this edition. So, this edition is in fact a call to the boldest healthcare innovators across India, startups which are reimagining diagnostics, AI driven care, digital health infra, and patient outcomes at scale. So, to Prashant as well as Sanjeev, what is that one space in Indian healthcare where you believe the next breakthrough is possibly going to come from? And what would you say to the startup that is building it right now? Sanjeev, let's start with you.
Right. I um, I think the breakthroughs are happening in multiple paths, and I see that both in the operational side as well as on the clinical side. It is going to be confluence of multiple technologies, but the impact we will see is definitely easier access. Cost will get lower. And highest impact is coming on the diagnostic side, on the different parts of it, be it on the pulmonary side or the ophthalmology or imaging. And so I believe this is where we're going to see the maximum impact.
Okay, Prashant.
Yeah, I think it's important to kind of think about what I started off earlier. How do you get more predictable? How do we kind of do early diagnosis? The more and Girish spoke about the later part of, if you kind of have late diagnosis, you end up having the risk of higher cost and high mortality. I think it's important to kind of see one thing that we need to think about for startups to think is around early diagnosis, risk prevention, detection, and all of that. And like Vikram said, there is a lot of data highways that have been created. How do we leverage that data to be able to build these models? A couple of things, it's the right time to kind of look and solve not just for one solution, but to look at how do we kind of improve healthcare for all? How do we build responsibly the solutions? How do we not just build solutions, but to scale as well? The last but not the least is while we are building something within India, it's also globally relevant. So as you think about building solutions, well, you think about India as one of the areas and the regions to be able to solve for, but what we solve for India is also relevant globally. So think about that as well.
Okay, all right, Prashant as well as Sanjeev, thank you very much for joining in and sharing your thoughts. Thanks very much.
Thank you, leaders, and thank you, Ms. Ekta, for that very insightful discussion. With this, we'll take a very quick 10 minutes break. We'll energize ourselves with some coffee and tea and gather back here again in 10 minutes. Thank you, everyone.